Hi there, Shadae. My name is Mohammed. I'm a nurse at this hospital, and I just spoke to the doctor. So, how are you doing today?
Well, I came to the hospital about 2 months ago with a cough and I was producing a lot of mucus. I was given some antibiotics for pneumonia and they took some samples of the mucus, but 2 weeks later I was still coughing and I started to lose some weight, and lately I've had no appetite. So then I went back. They said at the time that I may have TB, but like proper results take 7 to 8 weeks, and I've never had a respiratory infection before. So as I noticed that they started to make like precautions and stuff and kept me isolated in a room, and they didn't tell me why. No, the doctor told me that I have active TB, and I've been having a lot of anxiety while I was waiting to see you.
Okay. Well, TB is contagious, so within the hospital, we definitely want to try and protect the staff and the other patients. Tuberculosis is your disease, so that's the disease of the infection from bacteria, Mycobacterium tuberculosis. It's actually one of the most common respiratory diseases worldwide, so we do have a lot of information. There are some misconceptions, so coming to me is definitely first bet. It's spread through airborne particles, so coughing, sneezing, even talking, and prolonged exposure. In most cases, it's pulmonary TB, so that's affecting your lungs, but it can be extrapulmonary, so affecting your other organs, and we're definitely going to try and keep it within your lungs.
Oh, well, I just figured I would take the medication for 2 weeks and it would all be gone. How do we prevent infection from moving from my lungs to the other organs?
Okay, well, yes, your doctor's prescribed some antibiotics, and we also suggest home isolation to avoid spreading it to others. You will have to change how you interact with people, so I recommend wearing the N95 mask. I think you had a few of those that we gave you last time you left the hospital. Inside your home, it doesn't really make sense. You just have to be comfortable. It's best to be alone when you're at home, though. But do keep caution around people who have diabetes, HIV, children under the age of 5, or if anyone you know has history of like drug or alcohol abuse, they all have a lower immune response.
Oh, well, I have a 6-year-old daughter at home. Is she safe?
I would suggest she gets tested. We have a 2-step Mantoux test to confirm whether she's a carrier or not. From there, we do the same chest x-ray and sputum results to confirm if she has tuberculosis. However, anyone who does have TB, it takes a few months to actually develop the infection. Most people who actually get exposed don't actually get infected anyways. We have the BCG vaccine, so she can get immunized. We give it to all children, and it's only about 20% more effective than not having it, so it's best to have her stay with family if she can.
Well, how will I be able to go on with my life normally? Like, I still have to work, I need to go get groceries, I usually go to the gym regularly.
Right, so in the past, our clients have had reduced or modified work while treating the infection, and we do have some services that we can contact you with, so like groceries that bring you to your door, and we can give you an exercise plan to do at home and stuff like that for sure.
Okay, well, how long would I be in isolation for?
Home isolation usually lasts for about 2 weeks. After that, you will have another checkup with our TB specialist to see how your infection is doing.
Well, what about like friends and family? What am I going to tell them? If they think I'm like a disease, they might not even want to take my daughter in if they think she has the TB also.
Okay, well, I have 2 documents here. So I have a pamphlet that you can give to your family. It also has a link to a short video that they can all watch if they're more video learners. And there's also a link to a website at the back that has a plethora of information. So really anything that you want to know, it has it on it.
Okay, well, a video would be better for the whole family to sit and watch and then understand. Yeah.
So you can wear a mask, and you can also ask them to wear a mask. That way there's 2 barriers. It might give them a little bit more of a feeling of protection. It's actually safe to talk to them, hug them, even kiss them, and it's totally okay.
But you said that the disease is spread through the mucus in my lungs, so coughing and talking to people might get them infected. So if that's how it works, how can I kiss them and they don't get infected?
It is safe to kiss someone. You can even be intimate with them. So these acts don't actually spread the disease, but if you're coughing a lot and producing a lot of mucus, then yeah, you might transmit it through kissing. But really the biggest thing is long exposure. So I recommend airing out your room, not having guests overnight, and just allowing fresh air in your house.
Okay, I think that makes sense so far. Well, is there anything else we need to discuss?
We need to go over your medications and their side effects. So your doctor's prescribed INH, rifampin, ethambutol. And you were also prescribed pyridoxal phosphate, so that's managing your peripheral neuropathy. So if you ever have tingling or loss of sensation in your fingers or toes, definitely let us know. So the first 2 drugs, INH and rifampin, are there to kill the bacteria, so they're bactericidals. And ethambutol is bacteriostatic, so it's preventing more bacteria from coming back in that place. These medications have some other side effects, so your skin might become hypersensitive, developing rashes or anything like that. you might be a little bit more tired and lethargic as your body fights off that infection as well.
Okay, well, how do I manage all these symptoms? There seems to be a lot.
Taking medication with meals or even a glass of water really helps reduce the stomach disturbances. You might be more tired, as I mentioned, so you definitely want to have more fruits and vegetables. Keep up a schedule. Don't just sit around because you're at home. Just keep up and be active, really.
Okay, I think I have a good understanding of what's going on. I feel a little bit less anxious about the next 2 weeks then.
Well, that's great to hear. So I will see you in about 2 weeks. If you have any questions in the meantime, I've prepared a teaching plan which kind of summarizes everything we went over today. It has links to groceries, babysitting services for your next appointment if your family can't take care. It really has everything you need. It also has my number in case you need that. Okay? Thank you, Shadae. Have a nice day.
Thank you so much.
2 weeks later. Hi, Shadae. How are you doing today?
Hello. Well, I still have the TB, and my doctor said I will have to stay on the medication for now, but I've been managing the side effects okay. I only had an upset stomach on the first day when I took them.
Well, that's good. And no other side effects to report? That must be a good sign. So how's your daughter doing?
She's with her aunt most of the time, but I spoke with her on the phone and she's having a blast. It's like a sleepover party every day for her.
That sounds fantastic. So your doctor said your infection is decreasing, but we will continue the same regimen to hopefully have better results on the next time.
That would be great, but the home isolation thing has really been good for me. I have the time to read, cook. I do miss getting to see my daughter often, but she knows her mom is sick, and fortunately my family is very understanding after we watched the video, and they were actually very, very supportive.
Wonderful. That's great to hear. So is there any questions or anything else that we haven't discussed?
No, I think I have all the information I need. Thank you so much for your time, Mohammed.
No problem, Shadae. Have a nice day.
You too.